Hi, I'm Dr. Laurie Pozun, and I'm here at Lifescape Premier today. And I'd like to just take some time to talk with everyone about differences that can present between COVID and influenza as we're kind of rounding the corner into flu season. I know a lot of people are asking questions about how in the world am I going to figure out if I'm starting to develop symptoms? Is this the flu? Could this be COVID? What do I do with this? So I'm just going to kind of briefly review presentations for both, and as you'll see, there's quite a bit of overlap. So that's where sometimes this can get a little bit confusing. But onset of symptoms, duration of symptoms, that's where we're going to see some of these differences. And then in terms of complications, certainly some differences there. So as most of you kind of have heard at this point, COVID is obviously a different virus than influenza. It's a SARS-CoV-2 virus, and it attaches to a different receptor called the ACE2 receptor to gain entry through our mucosal surfaces. And it's also spread like influenza with aerosolized droplets in close contact. With COVID, it tends to have a less abrupt onset of symptoms, and you can see kind of more of a gradual progression to symptoms. The contagious period for COVID is very much still under investigation, but we know at this point that it's still possible to spread COVID infection up to, on average, about 2 days prior to symptom onset. But there's a lot of variation in that, depending on your immune system, depending on viral load. There have been some case reports where the pre-symptomatic phase can even be, up to 21 days. So that's definitely where there's some differences with COVID, in that you could be technically asymptomatic and still harboring virus and spreading that onto others. And I'll get into that, how it compares with influenza here in a bit. Symptoms develop on average about 5 days after being infected, and that's one of the big reasons why we get a lot of questions here like, I think I've been exposed, is it too early to be tested? When can I be tested if you feel like you've been exposed to COVID? So because symptoms develop on average 5 days after being exposed, that's one of the reasons why it's not really worth the time or effort to do a nasal swab until you're around day 5 or after possible exposure. So as I'd mentioned before, symptoms can occur as early as 2 days, even though after exposure, and as late as up to 21 days after exposure in some case reports. So that's a big variation between COVID and influenza. With COVID as well, you can be contagious for a longer period of time than with flu. With flu, symptoms can develop beginning even 24 hours after initial exposure. So I think of COVID as kind of a slow burn where, if you're exposed, the exposure period, the pre-symptomatic period is longer. With flu, it hits you hard and fast. So you can be exposed within 24 hours, have pretty significant symptoms. You also, with flu, you tend to be more anxious and have a higher viral load earlier on. So that's kind of one of the big differences there. With COVID, what we're seeing is that once you are infected, the highest contagious period tends to be around days 3 to 4, and then your symptoms can actually last for about 7 to 14 days. We'll kind of switch gears here and talk about influenza. With influenza, it attaches to a completely separate receptor called an H2 receptor, which is a hemagglutinin receptor. Similar mechanism of fashion, where when the virus attaches to this receptor, it gains entry into the mucosal tissue. It's again spread mainly through respiratory droplets, aerosolized droplets, and that's how the infection occurs. Definitely more of an abrupt onset of symptoms compared with COVID. So again, if you're exposed to influenza, oftentimes within 24 hours, you're feeling really, really not well. It comes on pretty hard and fast, as I mentioned before. The symptom development for flu tends to peak around days 3 or 4. That's when you really feel probably your worst. And then oftentimes will tend to kind of defervesce and get better after that. But flu symptoms can also last for anywhere between 7 and 14 days. Older children and adults do tend to be more contagious in those first 3 to 4 days and remain contagious for up to a week after that. Another point to remember is that people with weakened immune system, immunocompromised patients can also be contagious for longer periods of time, as they may not be as effective at clearing out the infection in a timely manner. So just keep that in mind. If you do have any predisposing factors, autoimmune conditions in particular, if you're undergoing treatment for cancer, your immune system, if you're exposed to flu, it may take you a significantly longer period of time to kind of clear out these infections. Let's talk a little bit about comparison with complications of flu versus COVID. With COVID, and again, at this point, many people are familiarized with kind of particularly the acute respiratory failure, potentially pneumonia, organ failure, septic shock, blood clots, as we know quite a bit about at this point, multi-system inflammatory syndrome, which is more prevalent in children, chronic fatigue, a muscle breakdown condition called rhabdomyolysis can be more prevalent amongst COVID patients. And most of this is related to how the COVID virus triggers an immune system response that basically floods your bloodstream with these inflammatory proteins called cytokines. And that's, again, kind of where that cytokine storm originates from. So essentially, I think of it as this virus really has the potential of causing significant cellular level damage compared with influenza. Long-term symptoms of COVID, and this is per the Mayo Clinic, and this is ongoing in terms of studies and research, but we're seeing more patients with issues with chronic fatigue, headaches, vertigo, heart arrhythmias, some pulmonary scarring, lung scarring, cognitive difficulties with memory and just cognition in general, and even hair loss. So those are kind of the typical reported symptoms with COVID complications. And with influenza, we see more of co-infections, secondary infections such as pneumonia, sinus or ear infections. It can also, though, progress to similar like COVID, sepsis, where you're getting a massive inflammatory response and infection through the bloodstream, where it can affect different organs. Myocarditis, encephalitis, which is brain inflammation, can be a complication of influenza, severe influenza infections, and multiple organ failure. So, also like COVID, with influenza, it can worsen, underlying chronic medical conditions such as asthma, diabetes, and heart disease. So that's definitely something to be watchful for with flu season coming around the corner here. We tend to see a higher rate of complications in patients who are pregnant and children under 5 years of age, particularly under 2 years of age. And, in terms of seeking medical attention, with flu, for adults, absolutely, if you're having any difficulty breathing, if you have any persistent chest pain, abdominal pain can be a presenting symptom for influenza, dizziness, dehydration, confusion. If you have a loved one and they're kind of difficult to arouse, that's highly concerning for some cognitive decline. Not urinating as typical as you would, that can be definitely a sign of dehydration. And with influenza, we do tend to see, higher fevers. So if you're not staying well hydrated, then that definitely can contribute to volume depletion and renal compromise, essentially. So If there's any worsening of fever or cough, if fever is not coming down, kind of a rule of thumb is typically we like to see a fever controlled and under 101, so that can significantly diminish the chance that you're going to have any complications related to that higher fever, such as dehydration. So if that's not controlled adequately and you're having trouble doing that at home, you definitely would want to seek medical attention for that. And really, if there's any underlying medical conditions that you do have, then with influenza on top of that, you want to be able to come in to get that evaluated as soon as possible. With influenza, and we have this very much year round in terms of the ability to do rapid testing for that. So keep that in mind. If you feel like you've got some symptoms that you're not quite sure are influenza versus COVID related, and we can help you here sort of differentiate that and do the appropriate testing in the office here. For children, for kids that we're concerned about having potential influenza infection, points to put across that you would definitely want to bring your child in for medical attention is if you're noticing any fast or labored breathing. For kids, particularly kids under 2 years of age, infants, if they're starting to develop kind of a bluish hue to their face or lips, that's basically a sign of poor oxygenation. That's a huge red flag, so you would want to get them promptly in for medical attention if that's happening. If your kids are complaining of any chest discomfort, they're complaining of muscle aches or pains. For example, like if your child's refusing to get up and walk, that can be, a presenting symptom. Anything where you're having a child that's having a persistent fever, especially above 104, that's a significant, emergent situation that you would want to seek help for that. And if you're just noticing they're less interactive when they're awake, they're kind of zoning out, they're not wanting to talk. That definitely could be a sign that there's some significant infection going on, and you would want to promptly get that child in for evaluation. For coexisting conditions, I'll just kind of touch base on this because, again, as I had mentioned previously, there are a lot of symptoms that coexist between flu and COVID, so it could get confusing this season. Both infections can actually be asymptomatic. Both infections can progress to severe symptoms. Again, just to kind of reiterate, both can have the higher fever, chills, cough. Mainly for both, it's going to be a dry cough. You can have sore throat with both, shortness of breath, fatigue. Both can present with a runny or a stuffy nose, muscle aches, headache, GI symptoms, particularly with children, vomiting or diarrhea. So that's both for influenza and COVID. So that can be a presenting symptom for both of those, more so in children. And then again, both have the possibility of spreading infection within even the first 24 hours or longer, prior to developing those symptoms. So that's that pre-symptomatic phase. One big difference I will mention that's been publicized, but I want to reiterate, with COVID, we're typically going to see, it's what sets it different from influenza is the change in smell or taste. So, if that could be the only symptom with COVID. So if you feel like that is becoming more of a prominent symptom or just presenting with that, you want to get in for testing right away. For treatment, I will kind of review over, some of the things that we commonly will recommend for influenza treatment. Really, if we can catch influenza within the first 48 hours of the symptom onset, we are able to initiate some antiviral medications such as Tamiflu that can really help to reduce the severity and the duration of the infection. If you're a higher risk person, or if the influenza infection is very ill and it's not caught within the first 48 hours, studies are showing that it can still be worthwhile and beneficial to start Tamiflu, even if it's outside of that 48-hour window. So I would say touch base with your physician. If it's been more than 48 hours, it's still worth having that discussion to determine if Tamiflu, if antiviral therapy would be appropriate. Certainly you want to limit contact with others. That goes for both COVID and influenza. You want to cover your nose and mouth and throw tissues in the trash can. A lot of these are common sense things, but good reminders. Wash your hands often with soap and water or an alcohol-based hand sanitizer. You want to really do a good job of cleaning and disinfecting surfaces and objects that could be contaminated, particularly with influenza, such as counters and light switches, faucets, etc. You want to really remain at home for at least 24 hours, after your fever completely resolves, and that's off of fever-reducing medications, Tylenol or Advil or Aleve. And then again, just to kind of reiterate, there's one big difference right now for flu. There is a treatment. At least it can significantly diminish the severity and the duration of your symptoms. So Tamiflu is the most common prescription that we provide. It covers type A and B influenza. And another point I want to reiterate is, if you have the flu and really any of your household contacts, whether they're children or a spouse, anyone within the household really should also receive prophylactic, treatment with Tamiflu as well. Because that can significantly diminish the chance that they're going to get the influenza infection themselves. It's dosed differently. Usually for prophylactic dosing, it's taken once a day for 10 days. And then if they end up getting flu symptoms, then you go up to the typical twice a day for 5 days for the treatment regimen. So that kind of covers treatment. With vaccination, I do want to kind of touch base on flu vaccination. I mean, with COVID, I'm not going to talk much about that because it's still really in the works. We're hoping to, have some effective vaccination for COVID. Reports are different, hopefully by the first part of the year, but it's got to be really something that's going to be safe and effective. I'll kind of defer that for now and just really focus on influenza vaccination. And I will mention, I've had some patients questioning whether they should get vaccination with COVID going around right now. I think some patients, and even I've had some patients coming in saying pharmacists are not recommending vaccination during COVID because I think there's a fear that maybe it could suppress the immune system further where they may be more apt to getting COVID infections. That's completely false. So the CDC is adamantly recommending that patients stay on vaccination schedules. This is probably the most important season for everyone to get a flu vaccine because we just don't know really what to expect. My hope is that, with most patients adhering to mask wearing, hopefully that will dissipate flu season, but we don't really know. So it's really important to recognize the need to vaccinate yourself and your family with the flu vaccine, in particular this season. And everyone should be vaccinated starting at age 6 months and up for influenza. Another question that sometimes I will get is, how effective is the flu vaccine? And it is very different based on the season. The CDC does the best job that they can to kind of figure out what strains are going to be the most virulent and active, and that's kind of how they manufacture the different flu vaccines for each season. So there definitely is some variation season to season in terms of effectiveness for influenza. The CDC kind of looks at the effectiveness of vaccines for influenza. They call it a burden of influenza, and it's assessed by the CDC every single season, and it takes into account the number of actual flu illnesses, the hospitalization numbers for flu, the number of medical visits that are happening because of influenza, and the deaths per season. For example, I pulled up some data from the CDC, and this is the most recent reporting for the flu season that was a really bad flu season between 2017 and 2018. And the CDC calls this a burden of averted estimates, where the flu vaccination on that particular year, which was a very bad flu season, prevented 6.2 million illnesses. That's pretty amazing. 3.2 million medical visits, 90,000 hospitalizations, and 5,700 deaths. That year, there were a total of 61,000 deaths. So I think when you kind of look at those numbers, I think it speaks for itself, and that definitely, taking a hard consideration on vaccinating yourself and your family with the flu vaccine is very, very important. Just kind of some facts that I think we as providers still hear time to time, that maybe there's some air of confusion. You absolutely cannot get the flu from the flu vaccine. It's not a live virus that's getting injected. There's always a possibility that just prior to getting the vaccine, maybe you're kind of in that pre-symptomatic window, where you start developing flu symptoms, and the timing is just right or wrong, I guess, however you look at it, where you would develop flu. But you can absolutely not get influenza from the flu vaccine. So, and again, it can significantly diminish the chance that you are going to get flu. But if you still get the flu with the flu vaccine on board, your symptoms will be significantly diminished in terms of severity and the duration of the illness. And so that's another perk of just getting the flu vaccine. And again, the flu vaccine is considered completely safe for 6 months of age and up. Okay, so flu vaccine options for this flu season. Fluzone is one of the main flu vaccinations. It's a quadrivalent, meaning it protects against four strains of influenza. This virus this vaccine does use eggs, egg products to grow the vaccine. So if you have an egg allergy, Fluzone would not be a good choice. But that one is appropriate for anyone ages 6 months and up. A newer one this season, which is also quadrivalent, again, meaning that it's protecting against 4 of the flu strains, is Flublok. And this one is egg-free, so that's a big bonus. The virus is actually grown in a cell culture, and this is approved for 18 years old and up. A third one is called Flucelvax, which is also a quadrivalent egg-free vaccination that's appropriate for ages 4 and up. And then we have the Fluzone, a high-dose Fluzone, again quadrivalent. It uses an adjunct to create like a stronger immune system in response for patients that are 65 years and older. So that's the one that we typically will recommend for age 65 and up, or for patients even that have higher risk factors, such as immunocompromised states. Oftentimes will qualify for a high-dose Fluzone vaccination. So, I would say kind of in terms of, what can we expect with this flu season? I mean, it's hard to say, with looking at last year, flu cases exceeded 35 million, and there were about 34,000 reported deaths. Compared with COVID this year, there are 5 million and 180,000 deaths. So when you kind of look at that disparity, you can kind of see how with COVID and influenza coming together during this season, it could be a tsunami. But hopefully with just appropriate, prophylactic measures, everyone just being cognizant of social distancing, continuing to wear masks, that the season, we'll get through the season safely and together. So I have time. I'm going to try. I don't have anyone helping me here today, but I'm going to try to do some questions here. Any questions that you have otherwise, I can afterwards kind of look through on our website and also try to answer those. But I'm seeing one question that says, does it mean that eating eggs is bad for viruses in our body? No, it just means that so a common way for many vaccines to be developed, they use eggs to kind of help grow the virus, and that's kind of how the virus is propagated and the vaccinations are made. So it's just that with some vaccinations that are egg based in this way, that if you have a true egg allergy, we would be concerned that there could be a reaction. But there are a lot of options that you can see at this point that there's the vaccinations are not egg based and they're grown in the cellular culture. So it doesn't mean that eggs are necessarily bad to eat, that it would propagate a virus, in the body at all. So I hope that answers that question. Let me see. I don't see any other questions popping up right now. But again, if you have other questions regarding this, I'm happy to answer them. I'll definitely be looking over. I just have another question really quick here. This is a good one. How long does the flu vaccination last? So, the recommendation currently is, and we are recommending sooner rather than later to go ahead and get your flu vaccine. Normally we'll recommend, anytime between September to late November to get the flu vaccination. If you're getting your flu vaccination in September, it's been recommended to consider getting a booster vaccine in the month of January, only because your immunogenicity could wane a little bit, and here in Arizona in particular, we tend to kind of get the later wave of flu. Although I will say we have seen a couple of pockets of isolated flu infections coming already into our practice. But in general, it tends to kind of start on the East Coast, move across the Midwest, and we tend to get the bulk of flu infections really kind of beginning like in November, December, January. We can see influenza kind of already, even into spring and into May. I had a couple of patients coming in with flu, positive flu tests. So if you get your vaccination now, which is entirely recommended, and I think you should consider it, but a booster in January would be something definitely to consider. But if you come in anytime in October, I'd say by November it would be ideal for sure. But if it doesn't happen until December, you just get one. The earlier the better. So that's kind of the sense of the recommendation for the flu vaccines. I really appreciate everyone joining me today, and I hope you found this useful. And again, I'm happy to answer any other questions that you have. You can just post them online, and I will definitely get to them. And I hope that everyone has a happy and healthy weekend. Have a great day. Thanks for joining.